Welcome to Unit 3 of the CLPNM Jurisprudence Education module. In this unit, we will review the standards of practice and conduct related to competent practice, including a review of the CLPNM Continuing Competence Program. The second category of standards includes the expectations for competent nursing practice. There are 18 standards in this category. A competent nurse can integrate the professional attributes required to perform in each role, situation, or practice setting. Professional attributes include knowledge, skill, judgment, attitude, values, and beliefs. These are the first three competent practice standards. You'll recall that in Unit 1, we discussed the scope of practice of the overall profession. The scope of the profession is broad. Beyond the competencies that are required for entry into the profession, each individual nurse will have a different range of competencies that fall within their professional scope of practice. Each nurse must, therefore, engage in an ongoing process of self-assessment and reflection to remain aware of areas of strength in their practice and areas where the nurse would benefit from further learning. Nurses must only engage in the practice of practical nursing to the extent that they are competent to do so. This may mean seeking guidance from other team members at times, referring a client to another team member, and accepting or seeking out opportunities for further education or training. We'll now look at a case scenario. Please pause the video and consider which standard of competent practice is being demonstrated. When you start the video again, I will discuss the scenario. In this scenario, by reflecting on his nursing competencies and informing the charge nurse that he was not able to administer IV vasopressor medication, Ben is demonstrating Standard 13. Acknowledge your limitations in skill, knowledge, and judgment, and ensure that you are practicing nursing within those limitations. Ben sought guidance and direction. This helped ensure that his unit was able to assign the right providers to the right clients. As a team, the staff on the unit was able to ensure that all client needs were met. Professional expectations for competency include applying nursing knowledge and skill to meet clients' needs. They also include applying judgment, critical thinking, and a process of critical inquiry. An LPN is applying knowledge and skill when they administer medication by applying their knowledge related to pharmacology, as well as several nursing skills in drug preparation, such as dosage or IV drip rate calculation, reconstitution of parenteral medication, and safe medication administration via various routes. But the LPN must also demonstrate critical thinking and judgment when administering medication. For example, by clarifying an order that is unclear, or by prioritizing the assessment of a client who appears to be in distress. Depending on the circumstance, the LPN, using good judgment, might call on colleagues to assist so that as a team, they can meet the needs of the client in distress as well as those of other clients. This will ensure that the administration of insulin or other time-sensitive medications is not delayed. An LPN who demonstrates problem-solving abilities in unpredictable circumstances and who appropriately weighs risks and priorities is an LPN who is demonstrating competence related to judgment and critical thinking. Competent practice also includes critical inquiry. Critical inquiry is a purposeful, disciplined, and systematic process of continual questioning, logical reasoning, and reflecting using interpretation, inference, analysis, synthesis, and evaluation to achieve a desired outcome. Critical inquiry expands on the meaning of critical thinking to encompass critical reflection on actions. Pause the video and consider the case scenario here. When you start the video again, I will discuss the concept of critical inquiry in relation to this scenario. In this example, Denise applied critical inquiry by asking herself if there was a better way to support the family members of patients who require resuscitation by reflecting on the observations she made of families when a family member was undergoing resuscitation. She proactively sought out new knowledge from the scientific literature. This literature then provided a basis for Denise and her colleagues to make an evidence-informed decision, which led to the development of a policy aimed at improving the level of care provided to patients and their families. Competent LPN practice involves holistic nursing care. Holistic nursing care considers all aspects of a person's psychological, physical, spiritual, and social needs. This type of care is comprehensive. Rather than aiming to treat illness, holistic care aims to enhance the overall well-being and quality of life of an individual. LPNs must also ensure that they have the competence to use the technology in their workplaces safely, ethically, and effectively, and to reach out for support and training when required. Each practice environment is different and will use a different range of technologies. Examples of technological applications used in healthcare include automated medication dispensers, such as the Pyxis MedStation, electronic patient documentation systems, such as eChart Manitoba, and virtual care systems, such as Manitoba Telehealth and HealthLinks. CLPNM has developed a practice direction on delivering virtual care, and it is available on the CLPNM website. Practicing safely, engaging in reflection, identifying and mitigating risk to clients, and using resources appropriately are all ways that an LPN can demonstrate competent practice and meet their competency standards. Reflection is a key component to competent practice. Reflection is the process of thinking back on or recalling a situation to discover its purpose or meaning. Reflection fosters an understanding of practice events and how one's own approach, personality, and personal history contributed to the way situations arose and how they were dealt with. Maintaining hygiene and sanitation are also integral to competent practice. This can be accomplished through strategies such as frequent hand washing, using appropriate personal protective equipment, and using sterile equipment. These are all examples of ways that you can contribute to client safety and meet your standards. Incorporating quality improvement principles into practice is another way to demonstrate competence. Quality improvement is an organizational philosophy that seeks to meet clients' needs and expectations by using a structured process that establishes indicators of quality, monitors performance against the indicators, and utilizes findings to make improvements in all aspects of service and care. On the next slide, we'll review a case scenario that involves quality improvement. Please pause this video and review how an LPN incorporated a quality improvement initiative into her practice. When you restart the video, I will discuss the scenario. Standard 22 states that practical nurses are expected to incorporate established client safety and quality improvement principles into their practice. In this scenario, Jade learned about a quality improvement initiative in place on another unit and applied it on her unit. Jade upheld her standards of practice and conduct by incorporating an established client safety and quality improvement initiative, namely, an established turning schedule to help reduce pressure injury occurrences to the clients on her unit. Demonstrating competent practice also includes using evidence to inform decision-making and inform quality practice. Evidence includes various sources such as scientific research, policies, consensus statements, and quality improvement data. The need for evidence often arises from a clinical question, such as, how can I reduce falls in my unit? Or what is the best product to use when I provide mouth care? Taking part in educational and professional development activities is another way to stay current with evidence. A commitment to competent practice and client-centered practice also includes a commitment to learning from and about Indigenous people. In this way, LPNs develop their capacity to contribute to culturally safe practice environments. This is also consistent with the Truth and Reconciliation Commission of Canada's call to action for healthcare providers. The Truth and Reconciliation Commission of Canada called for skills-based training in intercultural competency, conflict resolution, human rights, and anti-racism for healthcare professionals. Practical nurses who have not had training in these areas are expected to seek out resources to increase their skills and knowledge. Practical nurses are responsible for safe, compassionate, and ethical nursing practice that is informed by evidence and demonstrates competence. Please pause this video and consider which competent practice standard was most exemplified by the LPN in this scenario. In this scenario, Standard 14 is most exemplified by the LPN. Standard 14 states that practical nurses are expected to consistently and competently apply a framework, the nursing process, which is a systematic approach to practice that encompasses all steps taken by a nurse to meet the needs of the client, including assessment, diagnosis or determination, planning, implementation, and evaluation. In this practice scenario, Joe Cruz used the nursing process by performing an assessment of Mr. Smith's condition, determining that Mr. Smith had shortness of breath, planning interventions to help Mr. Smith regain his normal breathing pattern, implementing interventions to help Mr. Smith breathe comfortably again, and by evaluating the interventions and nursing care plan to determine if they were effective in helping Mr. Smith. Developing and executing a nursing care plan for Mr. Smith using the full nursing process is an example of nursing practice that meets this standard. There are many ways LPNs demonstrate competent practice on a daily basis. Let's look at some examples. In terms of medication administration, the practical nurse has the knowledge, skill, and judgment for good decision making about the appropriateness of medication ordered, the route, and the dose for the client through an understanding of pharmacology. To practice in a competent manner, the practical nurse is aware of and implements safe medication administration practices. Normal assessment findings. Science-based knowledge provides a foundation of normal structure and function of the human body. The deviations from normal become more obvious. Disease processes. With knowledge of pathophysiology, nurses anticipate and understand what expected abnormalities may develop, as well as determining appropriate and available interventions. Nurses also identify abnormal assessment findings and intervene appropriately. Personal communication. Nurses have the knowledge, skill, and judgment to build relationships that foster trust with clients and healthcare team members. As members of a healthcare team, nurses understand the various roles of other team members and engage with them constructively to optimize client outcomes. Nurses also communicate assertively, when necessary, in a manner that is not aggressive. And as members of the profession, nurses must also practice respectful listening, respectful speech, and respectful conduct.
The next few slides highlight the new Continuing Competence Program, which was launched by the CLPNM in 2023. Standard 28 states that an LPN must keep their knowledge and skills up to date by regularly taking part in educational and professional development activities that aim to maintain, develop, and enhance competence relevant to their practice area, including compliance with the CLPNM's Continuing Competence Program. One of the ways that LPNs meet their standards related to competent practice is through yearly participation in the CLPNM's Continuing Competence Program, also known as the CCP. This program exists to ensure that Manitoba's LPNs retain and continuously build their knowledge, judgment, and skill. The program also ensures that LPNs stay up to date on evolving evidence and best practice in their field. This contributes to high-quality, safe care for Manitobans. Today, most professions have similar expectations for ongoing learning. A commitment to maintain and build competence is part of being a regulated professional. The CLPNM is required to establish a continuing competence program under Section 15 of the Licensed Practical Nurses Act. This table provides an overview of the requirements for the CLPNM's Continuing Competence Program. LPNs participate in the CCP by applying their knowledge, judgment, and skill through active practice and maintaining the required number of practice hours, completing the annual professional learning module and quiz on a topic chosen by the CLPNM, completing self-assessments of their practice using the CCP Annual Self-Assessment Tool, developing personalized professional learning plans, which consist of a learning goal, learning activities completed to meet the learning goal, a description of the learning, and the impact the learning has had on the LPN's practice, maintaining a professional portfolio, and actively participating in the CCP audit. The CCP audit is one of the ways that the CLPNM monitors its registrants' participation in continuing competence activities. Each year, approximately 12% of LPNs are selected for the audit. CCP audit submissions are reviewed by CCP auditors, who are other active practicing LPNs or CLPNM practice consultants. Occasionally, there is a misunderstanding that only the LPNs selected for the CCP audit need to complete learning activities each year. This is not the case. As part of the Continuing Competence Program, all LPNs participate in learning activities every year. This is a requirement for maintaining ongoing registration with the CLPNM. Please refer to resources on the CLPNM website, especially the CCP Practice Direction and the CCP Instruction Guide, for more information on the Continuing Competence Program, the Annual Professional Learning Module, and the CCP Audit. Annual Professional Learning Modules, also known as APL modules, were introduced in 2023 and are now a required component of the CLPNM's Continuing Competence Program for Manitoba's LPNs. APL topics are chosen by the CLPNM. These yearly learning modules, which are mandatory for registration renewal, will provide information on topics related to the legislation, practice, and standards of the practical nursing profession in Manitoba. APL modules can be found on the CLPNM website. After completion of the APL module, LPNs must complete a brief quiz. The purpose of the quiz is to confirm learning and that LPNs have completed the module. The quiz is set up in the CLPNM's online registration system, and quiz results are automatically recorded in LPN online registration profiles. Each LPN has 3 attempts at attaining a successful result on the quiz, which is 80%. More information on the APL module and quiz can be found on the CLPNM website. Each year, the CLPNM conducts a review of LPN's continuing competence and learning activities. This is referred to as the CCP audit. The CCP audit supports the CLPNM in meeting its mandate to ensure that LPNs provide safe, competent, and ethical nursing care. It also assists LPNs in meeting their professional obligation to maintain and build their competence as nurses. The CCP audit includes 2 categories: the Quality Improvement Audit and the Quality Assurance Audit. The Quality Improvement, or QI, category of the CCP audit, also referred to as Category 1, is conducted to confirm that LPNs are building competence in their nursing practice and improving the quality of their care over the course of their careers. This is the audit that CLPNM registrants are accustomed to. Each year, a minimum of 10% of LPNs will be selected for the QI audit. Those selected for this category of the audit will submit 1 completed learning plan for review. Those selected may also be required to obtain verification of their practice hours. And any person selected who is self-employed must also submit documentation related to their self-employed practice. More information on what must be submitted, how to submit, and when to submit can be found in the CLPNM's CCP Instruction Guide. The Quality Assurance, or QA, category of the CCP audit, also referred to as Category 2, was introduced in 2023. The focus of the QA audit is on obtaining assurance that LPNs are demonstrating the competence necessary to practice safely, particularly when the LPN practices in a context or in circumstances associated with higher potential risk for clients. Please refer to the CCP Instruction Guide for examples of risk factors. Each year, approximately 1 to 2% of LPNs will be selected for the QA audit. Those selected will submit the same material required for the QI audit, but will have an additional requirement to obtain practice feedback and to develop and submit a second learning plan that is informed by this practice feedback. More information on what must be submitted, how to submit, and when to submit can be found in the CLPNM's CCP Instruction Guide. The CLPNM understands that you may have questions about the Continuing Competence Program and the CCP audit. Please use the QR code on your screen to access the CCP audit webpage, where you can access the CCP Instruction Guide as well as other resources to assist you.
Now that you have an understanding of the Competent Practice Standards and the CLPNM Continuing Competence Program, move on to the next unit to learn about the standards related to therapeutic relationships. If you have any questions about this unit, or if you have any other questions about practical nursing practice, please contact the CLPNM for more information.